Good morning and welcome to the Jersey Magazine here at 105.5 WDHA. I'm Jim Monahan. My guest this morning is Robert Kessler. He's the Senior Manager Donor Recruitment for Vitalant, the nonprofit community blood bank. Robert, good morning and welcome.
Good morning, Jim. How you doing?
I'm well. Tell us about your connection with Vitalant. How long have you been there and what different roles have you had, Bob?
Okay, prior to joining the Vitalant family of blood centers, we were community blood services located in Montvale, New Jersey. A little bit about Vitalant. Vitalant operates in 28 states, collect about 11% of the total blood supply in the United States, and we're the nation's largest independent nonprofit blood services provider. We have about 5,000 employees in total, and we serve about 900 hospitals and healthcare facilities.
What are some of the biggest obstacles that you've faced getting an adequate blood supply during a pandemic?
I think probably the number one, Jim, is the fact that we locally would really rely on high schools and colleges for about 12 to 15% of our blood collections. And since the pandemic has occurred, we really haven't had high school and college blood drives. So again, the community groups that have kind of filled the void for us have done a great job, but we're really looking forward to trying to get back to the high schools and colleges. So we're anxious to see how it's going to play out as the high school and college season kind of grows nearer and nearer in September.
I was reading an article, and I believe it was someone connected with Robert Wood Johnson Hospital, and she had said, Bob, that this current blood shortage is the worst that she's seen in 35 years. That's staggering.
Yeah, Jim, I've been at this a long time too, and I would say it ranks right up there with anything I've seen in the past. It really has been something different that we've had to try to manage. We've tried some novel approaches in terms of virtual blood drives. But again, I really think until we start seeing the high schools and colleges come back, and it'll be interesting to see what the businesses do as well, because again, since the pandemic has started, we've really seen a fall off in really the high school market, the college market, in business and industry.
How difficult, even before the pandemic, how difficult was it to get adequate blood supplies?
Traditionally, we've always been an importer from other areas of the country, and that remains true today. That we just don't collect enough blood to meet the needs of the hospital patients. And I think it might be a little bit of a Northeast type thing, because some of the other blood centers that operate in the area also run into the same issue. So it's been very difficult to get there in terms of getting enough people out to donate blood. It's not a good place where you want to be, because again, anytime you have uncertainty of having to depend on others for your blood supply, that's not a place you like to be.
Robert Kessler is the Senior Manager Donor Recruitment at Vitalant, the nonprofit community blood bank. He's our guest this morning here at 105.5 WDHA on the Jersey Magazine. Now, I was seeing that there are 4 different types of donations: whole blood, double red cell, platelet, and plasma. Can you go through the dynamics of each of those, Bob?
Yeah, the whole blood donation, I guess, is your plain vanilla donation. You can donate every 56 days. We're taking a unit of red cells. Double red cell donation, again, we are really collecting the equivalent to just about 2 whole blood donations. Based on that, you can only give every 116 days. So the deferral period between the 2 donations is much longer, 56 versus 112. And then finally, as far as platelet donations take a little bit longer. They take about 2 hours. Again, what we're doing there is taking the donor's platelets and then returning the liquid volume of their blood back to them in terms of the red cells.
Now, of these 4, which is the most crucial need?
Right now, Jim, we have an urgent need for blood and platelet donors. Right now, we have a particularly critical need for type O donors to come in, and also platelet donors. The need for type O blood is especially critical. Type O is the most transfused blood type. O negative is what emergency room personnel would reach for when there's not time to determine a patient's blood type. So again, right now we need all blood types, but we have a critical need for type O and for platelet donations.
And for someone who wants to donate blood, what are the requirements for eligibility?
Okay, you must be at least 16 years old. And if you're 16, you must have written parental permission, must weigh at least 110 pounds, be in general good health. And for your safety and to ensure a positive donation experience, we would like to make sure that you eat within 2 hours of your donation time and drink plenty of water that day and 24 to 48 hours beforehand. You will need to bring some form of ID, something with your name in one of the following, your date of birth, your donor ID number if you're a past donor, or your photo.
You have the donor ID number in the system though, right? For people who may
We
have
have it,
misplaced
yes.
it.
We have it, yes, but we still need some form of identification.
And, in terms of the pandemic with people getting the vaccine, how does that factor into their eligibility to donate, Bob?
Okay, there's no waiting time if you've been vaccinated. So again, you can donate after vaccination. So that's not an issue.
And I know you have 4 locations, if I'm not mistaken, here in New Jersey. There are 2 here in Morris County and 2 in Bergen County, Lincoln Park, Parsippany in Morris, Montvale, and Paramus in Bergen. Are you able to just walk into any of those locations? How does that work?
Okay, we ask that you schedule an appointment. Again, we're trying to still maintain and control the donor flow somewhat because of the pandemic. So again, we would ask you that you schedule in advance. You can go to vitalant.org and check our website. We have our donor centers listed there where you can schedule an appointment, as well as any open blood drives that might be in your area where you live. Or you can call 877-25-VITAL, VITAL.
Give that number again, please, Bob.
Oh, it's 877-25-VITAL.
Now, if a local group or company, community organization, whatever, if they want to set up their own blood drive, how would they go about doing that?
They can give us a call, or again, they can go on our website and fill out a form. That form will be generated to us and we can follow up. But again, if you're interested in a blood drive, you can give me a call at 551-579-3564. And we'll be happy to help you out.
I know one of the cool things, because WDHA has worked with Vitalant over the years, whether we've gone up to the Rockaway Town Square Mall or perhaps we've gone to a mobile site. There are a couple of different options that organizations and groups have, correct?
That is correct, yes. You can, again, go to one of our donor centers. You can go there as a group and we can schedule you into the donor center. You can have a mobile at a location. And we also have our self-contained mobile coaches that can come out where we can do blood drives.
So again, for WDHA listeners, Bob, who are interested in setting up something, where's the best place for them to go on the internet?
Vitalant.org.
And you gave an 877 number, I believe, a few minutes ago as well.
Right. Or you can call 877-25-VITAL, 877-25-VITAL.
Is there a more particular time of year that there's a greater need than others?
Jim, I think generally around the holidays, from my years of experience, I think that really from the middle of August to the week after Labor Day is probably the toughest time of the year to get donors to come out to donate. Because in the past and even now, school's out, people are thinking about going on vacation, going back to school. So there's a lot of things going on. So I in particular think that the holidays and particularly the time frame between the middle of August and the week after Labor Day is really one of the most toughest times.
Robert Kessler, Senior Manager Donor Recruitment at Vitalant. Thank you so much for joining us this morning here on the WDHA Jersey Magazine. We appreciate your time.
Jim, thank you very much for having me.